want people to have that knowledge. What I would say in terms of how people can be more involved locally, one of the things that we've been talking a lot with the state associations about this, we all can play different roles. One of the roles that A.P.A can play is by pulling together the experts in the field, pulling together the research, packaging it in a way that can be made available to the public, but also to our members and to our state associations who don't have to create all of that. They can tap into our website, to the resources that we have developed, and then use that to be, the experts in your local community. I would love to see more psychologists on television. I'm watching a lot of television, and I'm watching people who are sort of, identified as experts, and I'm thinking, man, we should have more psychologists doing that kind of work. And so I would really encourage people to think about how you might make yourself more available to the media. We certainly can help with that in terms of materials, and we even do some training around how people can be better presenters. So I think that's one of the things that we can do, but it's also making sure that communities know that you exist and what skills you have, and whether that's, you're a developmental psychologist who might be able to help a school district, or you're an IO psychologist who might be able to help the local government. There are just so many ways that we can help, and it really is trying to figure out strategies so that people understand those ways that our field can be helpful.
Great, thank you. Our next question from Jen Peltzer-Jones talks about stress over time, which has come up a lot today. So she has a concern that while we're identifying problems like pandemic fatigue, we're not developing in real time ways to address what we see. And we can't continue to promote the same strategies when this all first hit to manage the chronic stress. So do you see innovation in the chronic management of this pandemic? And can you share a little bit about the shift or the change over time that needs to happen for everyone, but particularly around psychologists? We have a number of psychologists writing in with respect to compassion fatigue and being able to care for their patients as well as for themselves. So I know that's a lot loaded into one question, but if you can touch upon the stress over time aspect as well as the care for ourselves and others.
Bill, you want to jump in there?
Yeah, sure, I can start. I think, that this is what I've sort of gleaned from what I think is going on. In the spring, there was a hard pivot to shutting down, to working from home if you were fortunate enough to do so, to e-learning, to finding out how to get groceries. And so it was really driven by fear, in a good way, right? Fear is a good motivator for us to follow the protective recommendations that we needed to follow. But you can't maintain that level of fear over such an extended period of time. It just, our bodies wear down. And now it's being replaced by fatigue. And the challenge with fatigue, of course, is that it also drives our behaviors, but not in such healthy ways often. And so what I'm seeing happening is not just that we can't keep giving the same advice that we were. I think in some ways we need to double down on it, because I think what we saw in the Stress America survey is that people aren't coping. They aren't doing the things we're trying to get them to do. They're reporting disrupted sleep. They're drinking and using more drugs. They're eating unhealthy. They're not staying. I think some of the activity's gone down. So I think we do need to remind people that those foundations are still critical. I think the innovative component is what Arthur was talking about. It's the population health approach that we need to take. It's about thinking about how we can bring psychological science at multiple different levels, not just in the therapy room, but what does it look like in schools? What does it look like in the workplace? How can we mobilize communities to support each other as we continue to go through this? That's my initial take, at least.
Yeah,
Go ahead, Sandy.
I was going to say, I'm going to add to that the time frame perspective is really important. I think when people think of a COVID crises are things that typically are very intense experiences that have a short time period in our lives. Unlike many other places in the world that have been in war and various conditions for years and years and years, our culture writ large is really not as used to having these ongoing kinds of events. And so for psychologists, I think we have to look at the perspective of this really is a very long set of marathons and not a sprint. And so we have to be mindful. We have to deal with ourselves like we would deal with clients. We have to very specifically, at a 4 or 5 month mark, look at what we think would be the changes. We know, for example, from high performance teams, not even from people in crisis, but just high performance teams that are at a very high level of performance for a very long time because they're trying to accelerate a project. There's a 6 month wall that hits there as well. So we know that you can't go at what is designed to be a sprint level forever. So what we really have to do is change the advice we're giving to people to say, stop, pause, look at where you are. And it may be starting back and giving yourself a little bit where you can, a timeout to actually go back and do the things that are highly recommended for coping in terms of self-care and stress management. But people have to be mindful of it. They have to get consciously mindful of it. Because I think we're in a mindset coming into the holidays right now that people are starting to feel like, well, I deserve something. I put up with all of this. I'm going to eat all of my favorite foods. I'm going to just take a little chance and be with my family. And we're going to do things that are really risky health behaviors for us, rather than thinking about now is the time to hunker down and see if we can get ready for another phase of this.
Yeah, one thing that I would add, one of the things and I completely agree with everything that Sandy and Bill just said, and that's been a part of my messaging, that we're in a marathon, and I think psychologically we have to prepare differently if we're in a marathon than we're trying to get through a crisis. And that one of the challenges, particularly for, I think, people who are going to be on this webinar, is that you have a lot of high-performing people who are listening to this, and the typical way that high-performing people respond when they get more incoming, they have more stresses, is that they increase their effort. And it's counterintuitive that in this environment where we are in a marathon, that's actually counterproductive, that increasing our effort in an environment where we're in a marathon will burn us out. And so we really do have to take that step back as we have increased demands and ask, how important is this? Is there another way that I can deal with this? Are there other strategies? And a lot of the messaging that we're putting out there is we're really trying to help leaders and managers understand the messaging and strategies that they have to employ if they're going to get through this real marathon. And that's maybe different than maybe what we would have talked about if we're getting through an acute kind of crisis that is going to be over in a few weeks.
I would just add one